Hello, everyone. Good afternoon or good evening to our East Coast families. Welcome to this career panel focused on psychology, therapy, and counseling. A warm welcome to all of you. I'm Dr. Jennifer Winward, the founder and CEO of Winward Academy. It is my pleasure to be with you all and to welcome our esteemed panelists. We're actually going to go ahead for all of you and put a link in the chat right now to all of their bios so that if you're interested in reading more about them and asking any questions during the Q&A specific to their backgrounds, you'd be able to learn more by reading about that. And kind of the structure for today is after chatting with Dr. Mashur, Dr. Fonsworth, and Ms. Espinoza, we're going to welcome them all back at the end for Q&A with questions from you, our attendees. Want to give you a little bit of background about this career panel. So it is proudly presented by the Carol Kimmelman Athletic and Academic Campus, or CCAC. For those of you joining us who might not be aware, CCAC is a world-class facility coming to Carson by breaking ground in early 2021. It is going to be the largest academic and athletic campus in the entire country, serving over 20,000 students in LA and beyond, thanks to incredible partnerships with the US Tennis Association, Tiger Woods Foundation, Disney, ESPN, AEG, LA Galaxy, the Karsh family, and Winward Academy. Now, I do want to give a huge special thank you to Martin Luther King Jr. Community Hospital for working with the CCAC team to organize such an outstanding group of panelists who are going to speak with you today and inspire your career pathways in such a critical area. On behalf of all of us supporting CCAC, we thank our nonprofit and school partners for collaborating with us on this panel and for participating with us today. I know there are a lot of teachers who have actually joined and are live streaming this to their classes. So just want to thank you all again for working with us to put this all together. Now it's time to introduce your esteemed panelists. So today we're going to be joined by Dr. Maria Mashur, who is a clinical psychologist at Martin Luther King Jr. Community Hospital. Also by Dr. P.K. Fonsworth, who is an addiction psychiatrist, and by Ms. Linda Espinoza, who is an integrated behavioral health therapist. Also joining us today is a student co-moderator. Carolina is joining us, and she is actually a sophomore at the University of Pennsylvania. She's double majoring in criminology and Italian culture, and then she is minoring in psychology. And kind of as a fun fact about her, even though she's from Uruguay, she is the representative for all things related to Italian culture at the University of Pennsylvania. So it'll be fun to have her with us. She and I are going to be working together to ask the panelists questions. So without further ado, I would love to welcome Dr. Mashur and Carolina to please turn on their cameras and microphones. And we will get started with the first question, which I believe, Carolina, you have the first question for Dr. Mashur. So please jump in.
Thank you so much for joining us today, Dr. Mashur.
Thank you for having me.
You're welcome. I would like to ask you the first question. So you have both a master's in marriage and family therapy and a Ph.D. in clinical psychology. Why did you continue beyond your master's? And what opportunities were available to you with each degree?
Thank you. Great question. Hello, everybody that's watching. I think that, when I started my master's program, I just fell in love with the field of psychology, and I knew that I wanted more. So my curiosity and eager to learn more is really what propelled me to keep going in my education. I wanted to improve the type of care that I could afford my patients, and in order to do that, I also wanted to see what else the field of psychology could offer. I think that having both degrees really gave me such amazing opportunities. I started my training in marriage and family therapy, working with children and their families, and completed my clinical psychology degree working with geriatric patients. So I was afforded the opportunity to work with patients throughout the entire lifespan, which really gave me a different perspective in how to work with different age groups, different populations, different ethnicities in various different types of settings. So I think that with that, I took little pieces of everything that I've learned into what I do with my patients on a regular basis. So I think the opportunities for each degree was what really expanded my knowledge, my foundation, and just core passion for the field.
Thank you so much. That's really amazing to see how many like doors it has opened for you. If I can ask you another question,
Please.
you have worked both with patients and in administration. What skills and traits are best for each role? And what would you tell me where I'd do best?
I think that I don't believe that I change depending on the role that I'm in. I feel like, I'm the same person within both. However, I adapt myself to whatever the role requires of me. So, one of the things that I really want to highlight is being detail oriented. Flexibility is huge. Regardless of whether you're seeing patients or you're working with administration, dependability, self-discipline, and I think the very most important thing that I hold dear is kindness to others. Kindness whenever you're working with patients, kindness when you're dealing with staff, when you're dealing with just the people around you in general. So I think, Carolina, for yourself with your background, I believe that you could do well in every setting, as long as you stay flexible in terms of how you adapt yourself, your personality, your skills to whichever practice that you're doing.
That's great. I'm going to jump in with the question. So someone actually put, and I think this is great, if you could clarify kind of what does it take to get a master's? And then what does it take to get a PhD? Kind of what is the time frame that someone should expect if that path is what's right for him or her?
Yeah, so I actually took the long way around this. There is a direct path to a PhD program after undergraduate degrees. You can, and in the process of completing your PhD program, you would then complete a master's degree kind of along the way. I, however, wasn't entirely sold on the field of psychology to begin with. So my foot in the door was the marriage and family therapy program, which was about 2 years. And then from there, I knew I just wanted more. So I invested the next 6 years of my life in studying and going deeper and delving deeper into the field. Most PhD programs are about 5 to 6 years.
Okay, great. Now, in your work, Dr. Mashur, you focus a lot on supporting marginalized communities and populations. So can you share more about what drew you to this specialty and what that's like for you?
Yeah, absolutely. Being a naturalized immigrant born in the Philippines and raised in Singapore, I understand the experiences of being a minority group. When I started working in the mental health field, I started within marginalized populations, and I knew that this is where I needed to be. I knew that there was such a disparity of mental health within marginalized populations that I felt that the work was here, that the work and, that this population needed good and strong clinicians to be able to support them in dealing with their mental health crises or their mental health symptoms.
Yeah, another question in here that I think is great is kind of how did you decide that this was your route or this was your path? Was there a singular moment that happened? Was there an interaction with a family member? Like, was there something where you kind of knew what you wanted to do?
Yeah, great question. I initially wanted to be a nurse. That was my initial educational path after undergraduate degree, and I worked in the ER at Children's Hospital. I remember this moment vividly. We had a overnight. I was doing an overnight shift working in administration, and we had a patient come in who had aspirated and passed away. And in that moment, I felt absolutely useless. I felt like I didn't know what to do. I had no training. But what drew me in that moment and what I found was my interest not in the medical side of it, but actually helping the family cope, helping the family process, understand, or even just sitting with them in their grief. that moment is where I knew that I wanted to be in the field of psychology.
Mm. That's interesting. And that does kind of echo a sentiment that was shared. So our last panel was on medicine and nursing. And the number one advice that all of the people participating gave was get into a hospital as a volunteer and make sure if this is the right thing for you.
Yeah.
So it's interesting because it sounds like you were doing that on your path to nursing. And then in the process, through this experience, discovered that maybe where you really wanted to be was in the interactions with the families and kind of coping or supporting their coping process.
Yes, exactly. That's exactly what I did. That was the advice that was given to me as well. And even, working in Children's Hospital, they were so kind, and they said, they wanted to actually have me in the rooms with them in their procedures to see if this is something that I could do, if it was something that I found interesting. And during my short period there, what I found most interesting was actually working with the family, working with the patient, and helping them through their crises more in a psychosocial standpoint as opposed to a medical standpoint.
Great. And one last question, if it's okay, can you maybe give us a day in the life of Dr. Mashur? Like how many patients do you see per day versus how much time do you need to spend doing paperwork or responding to emails or kind of tracking records? Like what is kind of a typical day for you?
A typical day always starts with a cup of coffee. And from there, it's working with patients. I typically see about 3 to 4 patients in the morning and 3 to 4 patients in the afternoon. I do try to be very diligent with my time to only see patients for about 45 minutes so I can give myself 15 minutes to document. Now, that's not always the case, but that's what I strive for. And documentation takes anywhere from about an hour, hour and a half at the end of the day.
Gotcha. So interesting. Well, great. Well, and I do want to do a quick message to the people participating. Remember, if you have any questions for Dr. Mashur about being a clinical psychiatrist, remember, you can throw those questions in the Q&A. I promise she'll be back. We are going to transition now from Dr. Mashur to Dr. Fonsworth so we can learn more about his work as an addiction psychiatrist. But, for now, again, please remember you can put some questions in there and then we will welcome her back at the end with all of the panelists. Okay, Dr. Fonsworth, welcome. Thanks for joining us.
Hi, thank you so very much for having me. This is an honor. Thank you kindly, Dr. Winward.
Absolutely, absolutely. So Carolina, did you want to start by asking Dr. Fonsworth the first question?
Yes, of course, I'd love to. Dr. Fonsworth, it is said that you offer a lifeline because you had one. If you're comfortable, could you please explain a bit about your story and how your personal experiences inspired your education and your career?
Sure thing, Carolina. So yeah, it's true that I've definitely been offered a lifeline. So I've had a very unique trajectory. Essentially, like Dr. Mashur, I was also born in the Philippines, although under very different circumstances. My biological mother, essentially at 2 weeks old, put me in the hands of an elderly Japanese American woman who was basically a neighbor. She took me in, she became my adoptive grandmother, and she's the person who raised me. Um, uh, like to sort of encapsulate this in a sentence, it's a trajectory from basically being a low-income orphan, essentially. I'm also the first in my family to attend college. From there, to pursuing an MD, MBA from UC Irvine, and also psychiatry residency at Harbor UCLA. These experiences, and then also fellowship at UCLA for addiction psychiatry. And also, I don't want to underestimate the power of college and where people go for college because, I just glossed over that. And at the same time, that's incredibly important. So I went to UC Berkeley for a double major in molecular biology and Spanish Lit. What I'm trying to say is that I have experienced widely divergent levels of privilege and its lack. These experiences have heightened my sensibility to marginalized populations, in particular the addicted and those who are suffering from psychiatric illness. There's a real part in that psychiatry has helped me make sense of my past, my challenges, and also my lived experience. I had always been really interested in the brain and the mind. I always, held in reverence people like Dr. Mashur and Linda, people who are ready and willing to take on that challenge, people who are willing, essentially, and able to work with the seat of humanity, meaning the brain and the mind. And also, education is pretty much the only mechanism to get out of poverty, right? And for me, there was, even when I was 16 and I think maybe a sophomore or junior in high school, I was like, I'm the only one who, can do this. Good news is, I'm smart. I'm going to work hard. I think once I was a junior in high school, I was like, I'm going to a UC school because that's where the smart kids in California go. I'm going to double major in Spanish literature and molecular biology, and I'm going to do a 5-year plan, and I'm going to study for a year abroad, in a Spanish-speaking country. UC Berkeley was definitely a springboard to a whole other series of successes. Working here with Dr. Mashur, with Linda, with incredibly talented people, and meeting other, sort of boundary crossing folks, it's an incredible place to be and work and serve.
Yeah, thank you for sharing more about your background, your experience kind of educationally and also personally that led you to your current career. I do have a question about that, right? You are an addiction psychiatrist, which sounds very specialized, right? I would almost think that there may be fewer than 5 addiction psychiatrists in California, right? I mean, it's such a specialized area. How did you choose that? Like, what led you to that specific area of psychiatry?
So definitely exceptional mentors have helped get me to addiction psychiatry, really helped confirm my dedication. One reason for psychiatry in itself is that I get to bear witness to and hold and understand, some of the darkest stories of humanity, and also the resilience, the resiliency, I think is the word, of the human spirit. All of that is just in so much more extreme in addiction. And, I remember when I was a 3rd-year medical student at UC Irvine, at working at the VA, the Veterans Administration Hospital for veterans at a rehab. And to sit in the room with folks as they're moving through, an Alcoholics Anonymous meeting, and hearing about the struggles, about how hard it is to move forward, and at the same time so necessary, and how they are doing it day by day, and how addiction is a disease that, affects the brain and deserves treatment. I mean, that is so galvanizing. I think from then on, there was that like inner seed of this is absolutely what I should be doing with my life. Addiction and mental illness influences who people will become. It affects self-image, it affects relationships, it affects aspirations. I'm incredibly humbled and inspired by how addiction psychiatry can help bring marginalized people back into the folds of society and allow for more rewarding and connected lives. I think what I'm also hearing a little bit in this question, Jennifer, is the, why South Central, why South LA, why MLK Community Hospital? Um, you know, um, there are very real parts of the third world. There are very real parts of the industrializing world that are present in America. There's a real part of me that's interested in those pockets here. There's a real part of me that's interested in those black boxes, opening those black boxes, like showing up, doing the work there. I have, also witnessed firsthand the impact that social, political, and economic forces have on the healthcare needs of fragile populations. In particular with the monolingual Spanish-speaking community, I've seen how the trauma of immigration reverberates in our patients, the discrimination, the separation from loved ones, the bicultural stress and isolation that can come from straddling two different worlds, all of which is heightened even more in the pandemic that we are living through right now. This is a challenging and also essential doctor-community relationship. And, with the team that we have, we are helping bridge that gap as cultural brokers between mainstream and marginalized communities, Spanish and English languages, and in a very real way, also business and medicine.
Yeah, that's great. And thank you for providing two kind of more insights about your specific work at MLK Community Hospital and kind of what that means to you and this team, right? Because all three of you, I think if I understand correctly, you all work together and have very similar goals in the work that you're doing in the community.
Absolutely.
So again, I think at this time, we're going to transition and bring on Miss Linda Espinoza to learn more about her work as a clinical social worker. But don't worry, Dr. Fonsworth is not going anywhere. So again, if you have any questions, please feel free to put them in the Q&A, and we'll have all of our panelists back in about 10 minutes to go through your questions. So thanks, Mr. Fonsworth. We'll see you soon. Okay, Linda, can you hear us okay?
I can.
Okay, perfect. Carolina, did you want to ask her the first question?
I'd love to. And thank you for joining us today.
Yeah, thank you for having me here.
In your work as a health therapist, you've chosen to support extremely high-risk populations, including the homeless, the severely mentally ill adults, and the terminally ill. That work, honestly, it sounds very difficult and challenging. And how do you take care of yourself at the same time that you take care of your patients?
Thank you, Carolina. I think this is a very good question on self-care that I have with myself ongoing on a daily basis, and also with the patients and the clients we see here as well. One of the things that I do value is self-care. That's how I've been able to work also in the field, I think, for so long. And with one of the things I've realized is that it's always going to be changing. It's always evolving depending where we're at in life. So, for example, one of the things, especially right now with COVID, it has changed the way we do things, the way all of us cope and do self-care. And so I used to go to the gym. But the gym and exercise is one of the things that I really enjoyed for self-care. A lot of like kickboxing to channel that energy and to channel maybe some frustrations that we have during the day. And those may be complicated cases that can ponder and leave us even after we leave here from work. And one of the things that it has changed because also of COVID is now working out from home. Right? I'm also a mom, so balancing all those roles and self-care is very important. One of the things I even tell my own family, hey, no, we're gonna bedtime for my son. It's no longer than past 8 o'clock because I need my 30 minutes or to an hour of just self-care, even if it's just gonna be watching Netflix or just making my favorite meal during the day or just taking a long bath to relax. Self-care, it's something that it's an ongoing process, always, even here in the clinic, reminding myself, hey, I need to take a breather. Let me decompress. Let me think about what's going on in that sense.
Yeah, that makes sense. And I appreciate too that you shared so many things that we are all also experiencing, right? And how COVID has kind of upended so many things. Kind of to piggyback on some of what Dr. Fonsworth was sharing about the communities that you're really focusing on. You know, a lot of people who pursue careers in social work struggle to make it, right? Because of the emotional toll that it takes. And you even just shared that some of your outlets that you used to pursue to help you cope with that are not necessarily available anymore. So what should someone expect going into clinical social work? Like what personality traits or what strengths would I need to know that I would be successful as a clinical social worker?
That's a very good question. I do think that with social work, it's very versatile. That's, I think, the nice thing with social work and what pulled me into social work. And so one of the things that, because it can be fast paced or it's always changing, right? Every day with patients that we see. One of the things that I do focus, and I think also Dr. Mashur shared earlier, in kind of like qualities and strengths, it's not only like empathy, right? Being able to empathize with our patients and ourselves, but also being adaptable and flexible, how Dr. Mashur mentioned, flexibility, that things will change, and kind of being okay with that it's not going to be the same always, as well as having good organizational skills. I think that's really kind of something we learn along our journey as social workers, having that self-love and self-awareness, because that's also going to be important, like that we don't get also emotionally burned out or things of that nature. We also want to know our own limitations, mirror those boundaries, not only for our clients and the population we work with, but also for ourselves. We all need some self-love and self-care. Also that eagerness to always be wanting to learn, be open to learning, that especially for a field that is rapidly growing at a very fast pace. And just being able to listen to ourselves and others in that sense. So I think those are the main strengths and qualities that we grow to learn to maintain ourselves.
Thank you so much for sharing the importance of learning how to be flexible and just simply learning about self-love and that you have to make time for yourself.
Mhm.
You've done both psychotherapy and case management, which seem very different. Is that true? And how do you choose between the both?
So yes, it is true. I've done both, and that's the versatility of social work, that we could do different things in different areas with different populations at different age spans, really. So a little bit about the two with case management, which how it really differs from the psychotherapy. Really is in case management, we are assessing, but we're assessing more of the social, the financial, the basic needs of a person that may need, right? All our basic needs, shelter, food, things of that nature. And then we kind of advocate for the patient. We link them, we coordinate, we advocate all of this kind of like resource package for the patient to make it more accessible, to make it more manageable, to reduce the barriers that anybody can encounter and maybe complex social systems that we have here. While in psychotherapy, we also assess, we diagnose, and we treat specifically mental health illnesses and disorders in that sense. So that's kind of how both really differentiate from both. And both, I think, has its rewarding side of it. I think that it really depends on the person to choose One of the things that I think has helped me, it's really exploring all of these possibilities. And I think that also helps ourselves grow and learn, because even though a job description may be specifically maybe more targeted towards case management, but maybe once we're doing psychotherapy, we may know those resources and case management, they can really be helpful with our patients, because we are there to really help the patients grow and evolve and feel better in that sense. And I think that that's the nice thing with social work, so versatile. I hear some social workers that are working for the federal government, for immigration, for schools, for, healthcare, other healthcare settings, like hospice, palliative. It's just so diverse. And it's not just with kids. It's with really the whatever span that we want to work with geriatric population, with adolescents, with maybe just domestic violence victim. So that's the really nice versatility of social work.
Yeah, that's great. And I love too that you kind of gave a preview of so many areas, right, where clinical social workers can touch. So thank you for kind of giving that preview. Now, what I'd love to do now is welcome back Dr. Mashur and Dr. Fonsworth for the Q&A. And maybe while they're joining us, Ms. Espinoza, you can answer this first question. It looks like we've had some people ask kind of what would you recommend to high school students who are interested in getting into clinical social work or into clinical psychiatry? Any advice specific for high schoolers?
One of the things that I do recommend is always just that helped me as well, and advice that I got is volunteering. Seeing other places, other facilities that accept volunteers, that we could shadow other social workers or even something similar to those fields that we like. I think that helped me see the possibilities, because how similar to Dr. Mashure's pathways, I actually, right after high school, was going to actually do pre-law and going into the law route, actually. But I found out very shortly that that's not my path. And the only way I really found out, not only with classes, but also being in an internship, volunteering activities in different agencies that are local to my home. And that helped me so much in that sense.
That's great. Dr. Mashur, anything to add to that? I know you shared earlier about your volunteer work and how that kind of helps set your path. Do you have any other specific tips for high schoolers?
Yeah, if, for your first couple of years, really affording yourself the time to take those introduction courses, introduction to psychology, or introduction to just explore. I think that, giving yourself the opportunity to explore and truly find what you would feel excited to wake up for every morning is the key. And it's not necessarily about the field in of itself. Sometimes it's really about like what excites you and what do you feel excited to get up every morning to do. I know for myself it was kind of a path to get there, but now I can tell you that I'm so excited to wake up every morning to work with my amazing team and to see my patients and just to be with them through their plight, through their successes, and to watch them thrive.
That's wonderful. Dr. Fonsworth, anything to add, specific tips for high schoolers?
Yeah, definitely want to dovetail Dr. Mashur and Linda about volunteering and sort of a kind of theme that we all shared is this idea of like not knowing at the very beginning. And that happened to me too. I came to Berkeley wanting to pursue a Ph.D. in cancer biology. I was like, there's no way I'm going to be a doctor, like, a regular MD doctor. That's so mundane. I want to, do research. And then, I did research, didn't really work out. I realized that, medicine is actually the best synthesis of these very radically different fields of, you know, Spanish language, Spanish literature, and molecular biology. So, you know, I threw myself at being a physician. I would say that you know, because psychiatry is a mix of, you know, medicine and the mind, even as a high school student, to focus on opportunities that that revolve around service and also the brain. At the same time, like what was brought up in the other meeting, there's a very, you know, people who go into medicine need to know, like, need to have some kind of clinical experience, like working directly with patients, so that they understand what more of those intricacies are. I would also suggest, like, you know, it's okay to just do one project, do it thoroughly, do it well, make it grow. What's gonna make the difference is where you go to school, what your grades are, and also the relationships that you have with your mentors and the faculty that will help, um, you know, help you carve the path that you want.
Yeah, that's great. So it looks like there's one question here that might be specifically for you, Dr. Fonsworth, but I'm sure that both Dr. Mashur and Ms. Espinoza are working with people with addiction. What types of addiction are you mostly seeing in patients and mostly treating?
Sure. So I not only work in the hospital, I also work in the clinic. And so in the hospital, there is a lot of, for example, methamphetamine addiction in the emergency room, a lot of alcohol. Once in a while, I'll have patients that suffer from marijuana addiction, which is called cannabis use disorder. Basically, when we say a use disorder, it's like sort of like a more scientific way of saying something other than addiction, which, you know, for some is like very stigmatizing, and at the same time like a real thing that happens and deserves treatment. So like I try to be as simple as possible, right? Like I just like to say things as they are appropriately. And then in the clinic, I would say the number one thing I see, you know, is alcoholism. We're really interesting in California, let alone Southern California, in the sense that, you know, like, right, like I'm sure even high school students and anyone who works in healthcare, like, has a sense of the opioid epidemic in America. I have seen a lot of opioid addicts. I've seen them more in like actual rehabs rather than in the community. There is this kind of mismatch. And at the same time, that's what we're here about. It's like, how do we close that gap and make sure that we splint people where they lie, that we, you know, meet people where they are.
Mm-hmm. Mm-hmm. And Dr. Mashur or Ms. Espinoza, anything you want to add about kind of what your experiences are working with patients with addiction?
Go ahead, Linda.
I think that Dr. Fonsberg was very, very thorough in that sense. We do see a lot of, here in the clinic, in the outpatient setting, a lot of alcohol use, a lot of cannabis use very often. And there is sometimes a little bit of incongruency in other stuff. But we do see that very often along with other mental health illness disorders such as depression, anxiety, trauma, which really are they go sometimes hand in hand with both together. We see that often, and we treat patients very often with that. Go ahead, Dr. Mashur.
Yeah, absolutely. And I think in addition to the substance use that we do see in the clinic, we also see other types of addictions as well. So for example, food addictions for patients with an eating disorder. you know, other types of behavioral addictions that does come up and are part of mental illness and are part of the patients that we see. So it's not just, I mean, the primary addiction, of course, is substances, but we also see other types of behavioral addictions as well.
Mhm. Yeah, interesting. Thank you for sharing. So one last question, and then if it's okay, Caroline, I'm going to ask you one more question before we end. But this question I think is great. So if I'm, you know, currently in high school, I'm planning to go to college, maybe I'm planning to major in psychology. What are kind of different pathways available to students who choose psychology as a major?
Yeah, I think there's so many different pathways that's available for psychology. There's psychology in everything. Most recently, I actually was talking to, you know, my partner who's a financial analyst about the psychology of the market. So even psychology in finance is a possibility as well. So for the field, there is marriage and family therapy, there is licensed counselors, there are LCSWs, there's psychology, there's psychiatry, and there's also other types of stepping stones as well that psychology can afford. In terms of like, you know, propels you for medicine, it, you know, propels you for other types of careers. So psychology in and of itself is actually a great major just because it's so broad and it applies to just about anything. Because in any field, in any organization, you will be working with other people. You will be working in a team. You will be working with customers, and psychology can be applied into all of those areas.
That's great. Such a thorough answer. I don't know if there's anything else to add from Dr. Fonsworth or Ms. Espinoza, anything else about psychology majors? No. Okay.
Well, yeah, I mean, I would just add that, you know, to sort of circle back on what Dr. Mashur said about the financial market, that there's also organizational psychology, which is basically psychology for businesses, and how psychologists can be embedded in usually more like medium to large size companies to help sort of navigate change and motivation, and, you know, overall, like, you know, increase company success, things like that.
Yeah, that's great. Thank you for providing that big range of examples for students. So Carolina, if it's okay, I would love to ask you a question just because, you know, you're a sophomore in college, so you're kind of closest in age to the students who are participating today. So I'd love if you could maybe just share some insights, right? You're interested in psychology, you're interested in criminology. How do you see that overlap and how they've kind of informed your interests and your future goals?
I think it all started when I took my introductory course to psychology as a simple general education requirement, and I realized just how amazing it was and how much there was to learn about the human mind, and how you can be influenced by society and many different factors. And I realized just how much of it can be applied to criminology and just in general the field of criminal justice, because I realized that many times we want to know why a person commits a crime, and at the end of the day, if we can find that out and we can figure out what is going on in their brain and what their thought process is, perhaps we can somehow change the future and we can help prevent future crime. And I just think it's so important to realize, to be able to understand and learn, like simply what goes on in their mind and what they're thinking about, and how perhaps their social environment can also affect the decisions they make. And there's a lot of courses I've seen in college, like that it combine these both of these fields. Like there's a course that is called biopsychosocial criminology, and it just combines so many different disciplines and many different areas, and it shows the importance of psychology in crime and the decisions that people make. And overall, I think that psychology is definitely a great major. If perhaps you're not exactly sure maybe of what it is that you would like to do, just because it can be applied in so many different areas and there's so many doors that you can open with it. So I think it's a really good major to at least look into and take an introductory course to.
Yeah. Thank you, Carolina. Well, it sounds like the introductory course that you took kind of set you on a path of different interests that you have. So yeah, that's part of the fun of going to college, right? Those first few years, lots of introductory courses to help you get exposed to different areas and refine what you're really passionate about. Well, I'd love to just give a final thank you to all of you for participating. Again, a huge thank you to Martin Luther King Jr. Community Hospital for working with us to organize and to ask you all to volunteer your precious time to join us today. So thank you again so much. Have a great rest of your Friday. And I just can't thank you enough for the wonderful insights you've shared today.
Thank you. Thank you for having us.
Bye. Good job, everybody. Bye.
You too. Thanks, Dr. Fonsworth. Bye-bye.